Does your brain ever sound like this? Well, I'm a clinical psychologist and I'm going to walk you through the 3 steps we teach in therapy for coping with this style of worries, which, by the way, are known as hypothetical or what-if worries. Step 1 is to ask yourself, what is it I'm actually worried about? Now that might seem obvious, but sometimes we're so caught up in the fog of anxiety from our worrying that it's not that clear to us what our worry actually is. So drill down and figure out, what is it I'm most worried about here? Step 2 is to ask yourself, is there anything I can do about this? The purpose of that question is to help you figure out, is this a what-if hypothetical worry or is it a real event worry? If your answer to that second question is yes, then that means it's a real event worry. So now what you need to do is problem solve. And then either go and carry out the plan or plan when you will be able to do it. What if your answer to the second question, is there anything I can do about this, was no? That means it's a hypothetical worry. So this is where step 3 is going to come in. As there's nothing you can do about it, worrying further isn't going to help. Worrying further will only make you more anxious. Step 3 is to distract yourself and find something else to absorb your brain in. And that's going to be really hard at first. If you're used to worrying and allowing it to spiral, trying to do something different will feel clunky. Your brain will want to keep going and finding the solution, but if there isn't one to be had, we know that that's not the best option. So here is where you have to repeat step 3 time and time again. Every time that worry thought comes back in, you're going to use some distraction to keep yourself busy and occupied and start to break that habit of worrying. Check the comments for more.